Hi, I'm Dr. Berman. I'm a plastic surgeon and frequently have patients that come into the office who want to have surgery performed on their eyes to make them look more youthful. Typically, the operation is performed on the upper eyelids and the lower eyelids, such that there's 4 incisions, one for each eyelid. And the operation is called a 4-lid blepharoplasty. I perform the surgery with patients asleep because I just think about myself. If I wanted to have an operation like that to make me look more youthful and less tired and fatigued, I don't think I'd handle it very well if I knew a surgeon was standing over me with a scalpel that was right around my eyelid. And I've done them under local sedation and general anesthesia. And in my hands, I get my best results with patients having it done under general anesthesia. The surgery usually takes between an hour and 15 minutes and 2 hours. So I tell them the surgery takes about a half an hour per eyelid. We draw an ellipse around the upper eyelid skin, and we cut that skin away. Underneath, we leave the muscle intact, and then we tease fat out of the medial and central eyelid compartments, because that contributes some of the bulge outward for the upper eyelid. We then sew it closed from an incision going from the middle aspect of the eyelid going out laterally. The lower lid blepharoplasty is done a little bit differently, where we make an incision right underneath the lash line and with a hockey stick extension inferiorly, such that when we cut that, we then pull forward what we call a skin muscle flap. And underneath the skin muscle flap is a layer called the orbital septum. And underneath the orbital septum, we will find the bulging from here, the medial, central, and lateral fat pads, which will then tease out the excess fat and remove that fat to give a more smooth appearance to the eyelid skin. Then we pull the eyelid skin in this direction, cut the excess skin away, and then sew that up. So at the end of the surgery, you'll have 4 suture lines, 1 for each eyelid. And again, the surgery takes me anywhere between an hour and a half to 2 hours to perform. The next question people to ask is what to expect during the recovery. Well, after the surgery, we bring you into our recovery room and we put ice around your eyelid grounds to decrease some of the swelling. We give you antibiotics and some pain medication. Typically, the patients have very, very little pain following the surgery, but we give you pain medication should you need it. We like you to rest without doing much close reading for about a day, and then you can start doing more close reading, because the fat that we take away is right around the muscles that help move your eye. And sometimes patients feel it's a little bit uncomfortable to move their eyes after the surgery. And also they get a little bit of blurry vision. And the blurry vision, a lot of times, is secondary to the antibiotic ointment that we put over the suture line to decrease the possible risk or possibility of an infection. So after the first day and a half of surgery, you're going to probably feel pretty good. You're going to be a little black and blue around the areas where we've operated, but you're not going to be in a lot of pain. You're not going to be a lot of discomfort, and you'll just kind of take it easy, watch some television. If you have a job where people need to see you and you need to see them, like now with Zoom calls or FaceTime stuff, you may not want to see them because you're going to look like you got beaten up in a fight, but that black and blue will go away. And the black and blue will go away anywhere between 7 and 14 days after the surgery. I rarely have patients that are black and blue past day 14. Usually by day 10, post-operatively, the black and blue has subsided. On day 7, after your surgery, the post-operative 7th day, you come to the office and we remove the sutures. We have you put antibiotic ointment for another day or 2, and then you just have to heal. For women, we recommend that you don't put any mascara on or eyeliner for 14 days after the surgery is performed. Then you can put on makeup as usual. I am okay for you to take a shower on your 2nd or 3rd post-operative day. Again, the typical course is relatively uncomplicated. You can take pain medications as needed, but I do prefer you to take antibiotics for at least the first 5 to 6 days following the surgery. We usually provide a Medrol dose pack, which is a tapering steroid dose to help decrease the amount of swelling that you have around the eye ground, as well as a formulation of bacitracin made for the eyes called bacitracin ophthalmic. And the patients usually handle this very well, and they rarely take more than maybe 2 Percocet pills in the post-operative course. In terms of how you know if you're a candidate for the surgery, well, your mirror is your best friend and worst enemy. So if you look in the mirror and you look at your eyes and you look like you have some sagging skin on the upper lids and some bulging skin on the lower lids, you may be a candidate for a blepharoplasty operation. Typically, people who want to have blepharoplasty operation are men and or women who are entering into probably the middle 30s to late 30s, and certainly up till 60s and 70-year-old patients have that excess skin. And a lot of that excess skin and excess muscle is, think about how many times a day you blink, aging, gravity. All of those things, and as well as stress, make our eyes look a little more tired. So when you look in the mirror and you may feel a little bit tired. You see some worsening rings underneath your eyes, a forehead, the eyelid skin, which is kind of falling over your eyelids. A lot of times women will come in complaining that when they put their mascara on the upper eyelid or eyeliner, they find that it smudges. And a lot of times that smudge is because the eyelid skin is draping over the eyelashes. As you can tell, I'm in my office and you hear the Outlook dinging, letting me know there's an email that I need to retrieve. Certainly that happens at the end of the movie. The movie that we just did took almost no time. Thank you so much for viewing this. And if you have any questions, please feel free to pick up the phone. Call my office at 561-417-0171, or you can certainly email us at info@drberman.com, drberman.com. Have a great day.